An infusion center is a place where patients come to the hospital, not to be admitted, but as outpatients, to get a treatment that requires us to put an IV in them or gain access to a vascular access device they have and deliver medicine through that device. We treat a lot of cancer patients, but we also treat patients who don't have cancer for treatment for conditions like anemia, Crohn's disease, multiple sclerosis. Some patients get chemotherapy in their doctor's offices, but large numbers of them come to us for their treatment because of the environment here. I mean, the light, the seating, the privacy that we can offer people. I mean, most cancer patients get chemotherapy as part of their treatment. Some of them also get radiation treatment, which is provided here in the cancer center as well. When we have a new patient come to the facility, one of the things I and the other nurses do is talk with people about our experience treating other patients with their conditions, and putting them at ease in that sense that they're in sort of competent hands, that we know what their disease is, we know what their treatment is, we've done it before, we know how to do it. We also try to empower the patients to manage their side effects. The pharmacists do a chemo teach, as we call it, on every new patient, so they tell them about the disease, about the drug, why it works, and about what they should do to treat the side effects, whether nausea, constipation, diarrhea, nerve problems. So that patients have information so that they're not surprised by what happens during their treatment. Helping patients manage themselves is very important. As I use the term empower, I think that they're our partners in treatment. They need to be able to see themselves as making decisions, which in fact they do. They don't really think of it that way necessarily, but they are driving the treatment. They can always say no. They can always say, this isn't working for me. I need something else. And the treatments we give are very, very important. If people don't get the drugs, they're not going to cure their cancer. So in order to get them there, we need to set them up for success. And part of that is making the predictable side effects more manageable for these folks. Seeing people succeed and seeing people cured is very rewarding. But just the relationship you build with these patients is rewarding for me and the other nurses. Again, it's good for the patients to partner. It's good for us too, because we work well with the patients. We can see the successes. We can help them through the hard times. And we're also telling them, you can take care of yourself. You can get over this. You can power through this, and we'll give you some tools to help you do that.